Is it possible that after a hair transplant, 100% result will come?
Thank you for your question. You're asking if 100% coverage is possible with a hair transplant. Well, it's a very reasonable question, and it's an ambitious question, but I can certainly give you my perspective based on experience and knowledge from my practice. A little bit of background: I'm a board-certified cosmetic surgeon, fellowship-trained oculofacial plastic surgeon. I've been in practice for over 20 years in Manhattan and Long Island. Hair transplant has been a very big part of my practice for many years. And in fact, I'm also the founder of TrichoStem Hair Regeneration Centers, where we help people with thinning hair non-surgically using a treatment we developed called hair regeneration. And we treat both men and women with genetic pattern hair loss. So the question of coverage is one that has plagued every doctor who performs hair transplant. And the challenge is certain limitations. Unfortunately, the geometry is not favorable. So the question that you're asking about 100%, let's just assume you have reached the most advanced stage of hair loss. Okay, let's say you're a Norwood 7. That being said, you think of the surface area of the scalp, and then you look at the donor area. What's the donor area? The donor area is a permanent zone where the hair never goes away. So if you think of the baldest man you've ever seen, that band of hair is the permanent zone that doesn't go away. That is the source for hair transplant. When you realize that essentially that donor zone is considerably smaller than the full scalp surface area, you know you can't get 100% coverage, nor can you get 100% density. This level of challenge and frustration is what has made hair transplant a procedure that has to be performed strategically. Hair transplant is done to basically frame the face. When we look at somebody who's considering surgery who has very advanced hair loss, we think, how can we get their face to look like there's a hairline and that there's hair in a way that gives them some volume and then gives them confidence in their appearance. It is no surprise that in surveys done to members of the International Society of Hair Restoration Surgery, that 65% of men wanted more density after transplantation and the completion of their hair growth after transplant. What we have done in our practice is we developed a solution for thinning hair called hair regeneration. And the relevance is as follows. When someone seeks attention for hair transplant, it's because they're losing hair. And if they're losing hair, what they're trying to do is transplant hair to keep up with the hair loss. With hair regeneration, we're able to, with an injection treatment, not a surgery, we're able to stop progression, we're able to reactivate growth, we're able to encourage or stimulate shedding of thinning hair and the growth of thicker hair. So you are on the right track because, frankly, when someone usually seeks attention for hair loss, they've already lost 50% of their hair. So with hair regeneration, we're able to achieve what is the most important thing, which is coverage. And then beyond that, if transplantation is appropriate, then transplantation can be done more strategically. Now that you understand the pure geometric and mathematical limitations of transplantation, what you want to do is stabilize, regenerate, and then consider transplantation. Well, at least that's my approach in my practice for people who come with hair thinning. Interestingly, most people who have been treated with hair regeneration are satisfied with the results and don't feel the need to have hair transplant. So understanding that, you may want to really think about this. Hopefully you're not in a situation where you've lost so much hair that there isn't much to work with. The limitation of our treatment is that if you don't have hair follicles, there's nothing to treat. So therefore, the earlier we catch someone, the better. We're treating both men and women in their 20s and even some in their late teens. So you can understand, the earlier we catch somebody, the more hair we have to work with. So I hope that was helpful. I wish you the best of luck. Thank you for your question.